Yorkshire Cancer Research are funding the largest UK lung screening programme because we have a goal to try and save 2,000 lives a year by 2025. Lung cancer is the biggest problem we have in Yorkshire. It's the most common cancer. 3,300 people die of it each year. And we know by finding it early that we can increase that survival rate to 9 out of 10 or 8 out of 10, which compared to the normal survival rate when you find it normally, which is only 1 out of 10 over 10 years, can make a dramatic difference. And eventually what we will aim to do is influence the National Screening Committee to show them a way to do this on a large scale. What's great about this project is we have the mobile scanners and the mobile trucks, which mean that people don't have to travel into a hospital setting, and it means people are more likely to come down to their local supermarkets. So it's really exciting to have the mobile trucks and the mobile CT scanner.
What we know from the United States is that where they've been offering lung cancer screening for 3 years now, is that actually very few people who might benefit from it are taking part, possibly only as few as 1 in 50. But we know from other experience in the UK that by bringing these checks into the community, people find it much easier to attend, much less intimidating, and so turn up in much greater numbers.
So the mobile units provide what we need to take our patients through their lung health checks. The lung health checks include electronic forms, lung function tests and a CT scan. The reception area means that patients got somewhere comfortable to sit while they watch the patient information video. Then they come through to consultation rooms where it's nice and quiet and we can do their informed consent and complete electronic forms. From there we take patients through to the clinical area where we do the pulmonary function tests, and from there they go on for a CT scan in the CT unit.
The coming together of EMS from a support vehicle perspective and Alliance Medical from a scanning perspective has been perfect as far as the patient flow goes. They can be on the EMS vehicles during the first part of their appointment, to have full screening services undertaken, only transferred into the Alliance vehicles when scanning is required.
So when I first stepped on a mobile unit, the first thing I thought was it doesn't feel like a mobile unit, it just feels like a standard hospital clinical area. It's quite light, bright and spacious and modern, and it's a nice environment and that's quite relaxed for staff to work in and for patients to visit.
So we're hoping that by basing these lung health checks in the community, in mobile units, that as many people as possible take part. We'd like people to come, maybe bring their relatives, do some shopping while they're here, and it's a nice, relaxed, comfortable environment for them to attend in. We're hoping that these health checks translate into lives saved in Yorkshire.